Good morning, everyone. My name is Yazan Shukir. I'm the head of market entry at AEI Saudi, and I'm pleased to welcome you all and thank you for joining our webinar today. The purpose of this webinar is to explore healthcare and life science opportunities in the Kingdom of Saudi Arabia and give you an overview of this vital sector. Just to start with some housekeeping rules and to make sure that everyone can hear us okay, there will be time for Q&A at the end of the webinar session. On the right-hand side of your screen, you will see a panel that will enable you to type your questions and we'll address them at the end of the webinar. And I ask you to please mention the name of your organization and who the question is addressed to. After the webinar, we will share our contact details with all of those who have registered. And without further delay, I'll be handing the mic now to Kabir Rahman, Chief Operating Officer and Head of Trade at the UK Department for International Trade and KSA for his opening remarks. Over to you, Kabir.
Thank you very much, Yazan. A very good morning to those joining us from the UK, and a good afternoon for everybody joining from Saudi Arabia and the region. It is my pleasure to participate in this webinar today. I've recently arrived in Riyadh to take up the position as Chief Operating Officer and Head of Trade at the British Embassy. However, I am familiar with Saudi Arabia, having previously served as the Deputy Consul General and Head of Trade and Investment at the British Consulate in Jeddah. It is an incredibly exciting time to be living and working in Saudi Arabia in such a transformational period of the country's history. Reforms initiated through Vision 2030 are moving at pace and have resulted in huge social and economic change. The United Kingdom is committed to be a key strategic partner for Saudi Arabia as it goes on this journey. Formal structures were agreed when His Royal Highness the Crown Prince visited the UK in March 2018 with the establishment of the Strategic Partnership Council. Healthcare is a priority sector for collaboration, and the UK appointed a special envoy for healthcare to underline the importance of this sector during the Crown Prince's visit. Healthcare reforms via Vision 2030 seeks to improve the quality of services and availability of world-class pharmaceuticals and facilities across the kingdom. Saudi Arabia is planning to spend billions of pounds to help deliver on this mandate. The UK is well placed to support Saudi deliver on these ambitious healthcare reform programs. The NHS is one of our most loved and cherished institutions in the UK, and the service is supported by brilliant UK healthcare and life sciences companies that help the NHS deliver the world-class care which is so respected and admired around the world. I am passionate to play my part to help bring the best of UK healthcare expertise to Saudi, to help the country deliver on its mandate, to further improve the quality of care for its patients, and help boost UK healthcare exports. There is no doubt that the COVID-19 pandemic has meant that 2020 has been a very challenging year for all of us. Although the headwinds from the coronavirus pandemic brought in its wake economic and financial stress, a powerful and coordinated economic response is vital. It is therefore critical that the UK and its trade partners continue to work together to keep global supply chains intact, trade lines open, and increase the resilience of pharmaceutical and healthcare organizations. For those of us based here in Saudi Arabia working on trade, our job is to try and support British companies be better informed about some of the opportunities in the kingdom. Experience shows there is no better way of doing this than arranging for businesses and experts to talk to one another, which is what we're trying to do here today. We have an excellent group of speakers lined up for you during the next hour, and I'm very, very grateful to all of our speakers who have taking their time out to help and support and their continued collaboration on this. You will hear from KPMG on the precise nature of Vision 2030 healthcare reforms, the SFDA on their services, the organisers of global health, and finally, you will hear from my excellent colleagues in DIT and our healthcare specialist about how we can help you do business here in Saudi Arabia. But first of all, I'm delighted to hand the mic to, I believe, Stuart D'Souza from AEI, who are DIT's official overseas partner, to provide us with a market overview. Stuart, over to you.
Thanks, Kabir, and good afternoon and good morning, everyone. As Kabir said, we are AEI. We are the exclusive partner to the UK Department for International Trade to provide market entry advice and guidance to British exporters looking at the Saudi market across every sector in the Saudi marketplace. We've been going for just over 7 years, and in that time we've helped over 1,000 mainly British exporters to be successful in the kingdom. We have a global network of partners and relationships that mean we really sit at the crossroads of most foreign businesses that are seeking to be successful in Saudi. As Kabir said, Graham and the SFDA team are going to give you a very detailed or deep dive, if you like, into the healthcare sector. And I'm just going to spend a few minutes giving you an overview of where we are at the moment in terms of the general Saudi market. Just to start off with, in terms of COVID-19 and the current status of travel restrictions, I'm sure many of you have obviously been locked down either in the UK or here in the Kingdom, getting used to working from home and dealing with curfews and downloading track and trace apps and all that sort of stuff. But of course, there is no substitute for face-to-face meetings, discussions, and that sort of thing. And of course, especially that is especially true here in Saudi Arabia and this part of the world in general. Last week, flights were resumed, so inbound flights resumed, although the Kingdom has said that they will not get back to a full schedule of what we might expect to be a normal flight schedule until January 2021. So inbound flights are available for those of you with existing visas, and obviously you're subject to quarantine on arrival at the moment. That is 2 days of quarantine in the Kingdom, and then a test. If you receive a negative test, you will then be released from quarantine. The Saudi Embassy in London is due to start accepting applications for new visas, either Iqamas or business visit visas, this week. And we have been told, but again, not 100% clear, that there'll be no tourist visas issued until the new year, until January. So if you need a new visa, if you need a letter of invitation, we can provide that, and please get in touch via Yazan or the DIT team. Just coming back to Vision 2030, Graham is going to give the update in terms of the healthcare sector, but more broadly, I'm sure most of you are aware really of what Vision 2030 is all about, and it is essentially one of the largest transformation exercises ever undertaken anywhere in the world. And it really is a monumental undertaking in Saudi. I want to just give two examples of where the challenges are, and outside of healthcare, one of the key focuses is the development of tourism, and really 2020 was supposed to be the first full year of tourist visas in action, and was supposed to be a great year for international tourism as well as the domestic tourist market. And although staycations have gone through the roof, obviously, in the last couple of months because of the lockdown in terms of international flights, there are lots of anecdotal stories of hotels not allowing women to use swimming pools, people being pulled out of the sea kite surfing because they don't have a permission from the Ministry of Interior. It's an illustrative of the depth of the transformation that is needed, and really the challenge here will be the same in every ministry, which is the leadership are fully committed to the goals, but the machine underneath the ministries and the processes and procedures and awareness, that is a transformation that is going to take years to fully embed. We have a project with the Ministry of Education where teachers have refused to allow their students to participate in events because music is playing. That sort of mindset is a key focus for the transformation, and the leaders in the Kingdom are very clear about that in terms of the direction of travel. But bringing the vast sort of public sector along with them is going to be difficult. So those of you that are involved in transformation projects, it's really key to understand exactly what the starting point is for the institution, organization, or ministry that you're seeking to transform. The current sort of status of the economy, well, like the whole world, Saudi is reeling from the COVID-19 crash, and there's been a double whammy. Obviously, you'll all be aware of the extraordinary volatility in the oil price, particularly in the middle of the year, and that has put enormous pressure on budgets in the kingdom. And we're already seeing it going into Q4 that many ministries have had their budgets frozen, have been told to make cutbacks, and there is certainly becoming a little bit of a two-tier market out there. There are some ministries that are perhaps seen as less of a priority, that are having funding cut and having funding frozen, and then other areas, particularly associated with the giga projects and some of the royal commissions, that we're seeing funding relatively unimpeded at the moment. The outlook for 2021 is, I think that there, and not just my thoughts, but the broad consensus is that there will be some consolidation. There's potentially going to be a reorganization of some of the royal commissions and the management and administration of some of the giga projects. And we're also expecting the 2021 budget to be very much more focused on national priorities. Having said that, Saudi Arabia as a market in 2021 is going to be one of the few markets that will continue to be spending a lot of money on international procurement, on international consultancy, and of course on major capital programs. It is likely that some of those programs that were perhaps slated to start in 2021, for example, Riyadh Park, or the Jeddah Tower, or other projects, are likely to be delayed. So the expectation is 2021 is obviously going to be a tough year all over the world, but Saudi will keep on spending, but it's going to be more focused. GDP growth is expected to return, and that's largely going to be tied to the upswing in the oil price, which is or at least the stabilization of the oil price. I suppose that's more accurate description. And lastly, from me, for those of you that are seeking to do business here, those of you that are perhaps looking at Saudi as a first-time export market, or if you're here and looking to expand, and you will face a lot of challenges in Saudi Arabia, but it is a market that rewards commitment and perseverance and patience. And if you need advice and guidance, if you've got problems, you're facing challenges, please contact the team at the embassy, and we're all here to support British exporters to be successful in Saudi. Thank you. I'll pass back to Yazan, I believe.
Thanks very much, Stuart. That was very informative. I'll be handing now to Graham Gilly from KPMG to give us an overview of healthcare within Vision 2030.
Hello, everyone. So thank you, Stuart, for that. That's a really, really nice summary. I think before we start, health is one of the areas that is, I'm going to use the term protected, but what it's seeing is less of an impact on the reprioritization. I think everyone recognizes the value health brings, and especially in a COVID environment, the importance of continuing to fund services for citizens. My brief was to cover the largest and most complex transformation program in the world and do that in 10 minutes. Obviously, it's impossible. It's a challenge. So what I'll try and do is cover off these 4 areas, which is provide a general overview of the health sector, understand what programs are going on. I'm going to focus on the Ministry of Health as the largest player in the health sector, but I'll explain a bit more in a second. Consider the new VRP program. So there's a new initiative coming in that hopes to align everything. And then finally, well, what's the impact of COVID-19 on the sector and the market in general? And I'll just pick up a little bit on that at the end. If I could have the next slide, please. So just to give you an understanding, so you're UK-based companies. Saudi is a much more complex health environment than the UK. So we have the Ministry of Health that's responsible for healthcare for the Saudi population. But we also have a number of ministries that also provide healthcare to the staff and also their relatives. All in all, we have a large number of hospitals, primary healthcare centres across the kingdom, and they provide, certainly around Jeddah, the Belt Jeddah, Makkah, Medina, Riyadh, through to Dammam, Hobart, very, very good services. And actually, when you go wider, you've got a range of specialist services on that central belt, which are comparable to services anywhere in the world. The complexity at the moment is what's driving the BRP. But if we focus predominantly on the Ministry of Health, that's probably got the largest and most advanced transformation program in the kingdom at the moment. Ministry of Defence, Ministry of Interior, Ministry of National Guards are just finalising their Vision 2030 strategies. Ministry of Education has taken a slightly different route. And King Faisal Specialist Hospital is an independent hospital funded directly from the Royal Court, and it has its own agenda to look forward to. Every single one of these ministries or organisations has its own set of agendas, its own potential market opportunities. If we can move to the next slide. Okay, so we talked about the expenditure, the total expenditure across Saudi in government. 2019, 1.1 trillion, jumping to 1 trillion. There was a little bit of a cutback. In reality, I think once they close the books, it's going to be higher than the 1 trillion because of the impact of COVID. Some work that was done by the Ministry of Health looked at the health expenditure, and at the time, this was 2016, they were spending about $21 billion, and that was projected to grow to 48 billion by 2030. And within that, this is probably understating quite significantly the amount of total expenditure across the sector. What they recognised was that's unsustainable. They're seeing a sort of 7% growth year on year. And with a population that is, at the moment, they're very lucky, 70% of the population under the age of 40, it really was unsustainable. They came up with their whole transformation program, and the aim of that was, the business case for it, was that by the 2030, they'll only be spending 33 billion. So they'll have saved a significant amount of money, but they're also prepared to invest a significant amount to get there. If we can move to the next slide. Just taking a step back and thinking about the health sector overall. We've got a young population we've talked about, but actually quite a lot of lifestyle issues. As you can imagine, there's a huge reliance on cars, not much on exercise. So they've got quite a significant amount of lifestyle issues, with 60% overweight or obese, no regular checkups, so quite a weak primary health care at the moment. They're seeing a massive increase in chronic conditions, and interestingly, they've got some of the highest rates of things like hypertension, diabetes, in the world, certainly once you take into account the age of the population. And I talked about the spiralling costs. They reckon 46% are due to deaths, premature deaths, non-communicable. So the potential price here, the impact is quite significant of changing the way they deliver healthcare. And it's fair to say that 3-4 years ago, when this started out, they had a health system that was very 1950s in its perspective, very similar to most health systems around the world before they've been through their big transformations, in that it was focused on hospitals and curative treatments, not recognizing at all the need for prevention or even active management in community and primary care settings. I've put some aims and targets on the right-hand side. I won't go through those now, but by all means, you can have a look at those. But you can see their focus is shifting very much. They want to move away from this, building more hospitals, providing 80 to 90% of their treatment in hospitals, to moving away and providing far more in the community and engaging patients and activating patients to manage their own care. Very, very similar to the UK and the NHS. So if we can move forward to the next slide. So the transformation is built around 3 pillars. Certainly for the Ministry of Health, it is both the regulator, or it is a regulator, it is a payer and a provider. And the intent was to split that into 3 elements. To have a separate payer, which is FAP at the moment, that will soon become their healthcare insurance. organisation. That will be responsible, very similar to NHS England, be responsible for developing capitated budgets and to hold clusters, which are ACOs or integrated care systems in NHS parlance, to account for delivery of improved quality and outcomes for the budget they're getting to meet the needs of their population. We've got the provider. So this is the health holding company initially that's responsible for taking on board all of the new clusters. And clusters are very, very similar to integrated care systems in the UK. Groupings of hospitals, specialist hospitals and primary healthcare centres under a single management structure and responsible for the population needs or meeting the population needs. And then finally, the Ministry of Health will become a uber regulator or a super regulator and take under its wing all of the separate regulatory functions at the moment that sit across the sector. That will encompass organisations like Saudi Food and Drugs Administration, Saudi Commission for Health Specialties. So if I just focus on the provider arm at the moment, because that's probably the area that has the most interest from the point of view and opportunities. Health Holding Company, the BRO at the Ministry of Health, has 6 work streams predominantly. We've talked about FAP, which will be the payer. There's a big piece around sector governance. So this is understanding how do we empower and delegate responsibilities down to the new clusters, each of the regulators, so that effectively they can deliver their functions in this new world. And that covers everything from the establishment of boards in clusters right the way down to delegated authority, decision-making powers, the ability to retain funding, etc. We've got corporatisation and model of care. This is the engine room. So this is the creation of those clusters, but also implementing a brand new model of care. And this is focused, this was developed about 3 years ago, is on full rollout at the moment across the sectors, and aims to shift the balance of care from hospitals to primary care, but also to empower and activate patients to manage their own care. There's a big push across all of the Vision 2030 themes and initiatives around involving the private sector more. This is really critical for the Kingdom. They want a more diverse economy, and they want to move away from government-provided services to more private sector-provided services funded by government where needed. And then workforce. Workforce represents one of the biggest challenges. It's a huge amount of staff within the Ministry of Health. Roles will change, responsibilities will change, functions will change. All of this needs to be supported by increased training, development of workforce, identification of future leaders, and the pipeline of those to bring them through as the system develops. And then finally, e-health. It's fair to say that the Kingdom, it's a bit binary. If you're sitting on that belt, generally, most of the hospitals have relatively good systems, IT systems. It generally is, if you're a big specialist hospital, you've got fantastic systems. As you move out into secondary care, it's a bit more patchy. As you move out from that belt, generally, a lot of the hospitals, I think up to 70%, are still running paper-based for some or all elements of hospital administration. And there's a huge program to roll out EPRs and hospital information systems across the Kingdom. In addition to that, they recognise the value of apps and app-based support, again, around the patient empowerment. So there's an entity been created, or at least been contracted with, Lean Business Services, whose role is to act almost as the integrator, and the integrator not only across the public sector, so this is all of the healthcare providing ministries, but also the private sector. And that's working very closely with the CCHR, the Commission for Cooperative Health Insurance. All of this all needs to come together in the next 3 to 4 years, so that clusters will be formed, new systems will be operating. There'll be ACOs starting to come in after the clusters, they're the precursors, and all of these systems will need to come together to provide this new vision and to achieve the targets for Vision 2030. If we can move to the next slide. That would be great. So I've talked about the fragmentation. Literally in the last month, it's been talked about for probably the last 8 months, but with COVID, things have slowed a little bit. There's been a recognition that having lots of different health sectors heading slightly off in slightly different directions has the potential to increase cost and reduce certainly the integration and quality of care provided to patients. So all of the key ministries have now signed up to a vision realization program. And basically this is a cross-sector alignment and planning initiative to begin to bring everyone to a single perspective, point of view and a single strategy. It'll be centrally led by the Ministry of Health through the Vision Realization Office, and is absolutely focused on integrating care and really defining responsibilities. So I talked about all of the fragmentation. To give you an idea of the level, the Ministry of Health would say its responsibility is for the whole Saudi population, which includes expats as well from their perspective, so that's 32 million. The Ministry of Defence would say its responsibility is to its staff and their families, so that's 7 million. The Ministry of Interior, they think about 4 million they cover, and the Ministry of National Guard thinks about 1.2 million. When you add all of these population up, they're developing a health system to cover a population of about 47 million, when actually the true population is about 18 million, which is Saudi nationals that they're responsible for, and probably a few million expats who work for those entities. So all of this has driven the kingdom to think more strategically and to say, actually, we need to bring this all together so that we're not having the level of duplication we maybe currently got. All of this will move forward. It's very early days. It's a big strategy piece coming out early next year that will start to then create that single vision. And then on the back of that will be a series of initiatives and adjustments to current initiatives. But the opportunities out of this are quite significant, because now you're not dealing with maybe an initiative or a tool that only impacts the Ministry of Health. It's now something that will be truly a national solution. We could just jump to the next slide. Fantastic. So COVID. So Stuart very succinctly covered some of the challenges that COVID has brought. As I said, it's less impactful, I think, on the Ministry of Health. What we may see is maybe a pause or a delay of some programs, but we're seeing now, now that the initial solutions or the implementation of the solutions to deal with COVID has passed, and it's now more business as usual, we're starting to see now the shift back to the transformation. So although there's been a cessation of any programs, that's now, in the last probably 2 months, we've seen another run of RFQs and RFPs coming out. Most of those will be awarded early next year, I think. I mean, it's you never quite know in Saudi, but probably early next year. They've undertaken a review, so they now know which of the programs they absolutely need to move forward with quickly and which are the ones that they can pause. And effectively, over the next 6 months, you'll start to see more and more RFPs and opportunities to respond to these coming out. What COVID's done more widely, though, is it's really brought the reliance of Saudi on imports into absolute sharp focus. Saudi has managed really well through COVID. It's responded quickly. It's taken some hard decisions, but it's seen the positive impact of that. But on the back of this, they're already, even the discussions I'm having are talking about how do we bring more manufacturing of products and services into the country, so it gives us a little bit more resilience, and it also diversifies our economy. So if you're an organization that is either looking at supporting the development of a company within Saudi or actively investing in Saudi, the level of support that you'll get from the Saudi government is significant at the moment. There's also been an acceptance, and I think you've seen this in countries around the world, that actually, you know, our front door to healthcare is not the front door of a hospital or the front door of primary healthcare, it's now digital. So what we're seeing now is a renewed focus on where technology solutions can help manage better patient care or allow patients to access care more effectively and efficiently. And there's a number of reasons for that. There's a whole drive around efficiency and effectiveness, but actually this is around the recognition that during COVID, patients have actually liked using the electronic tools that have been provided to them, and they want to build on these. I think that's probably it for me. There's probably lots of questions. I mean, it is phenomenal to see a level of change that's impacting payer, regulation, provider care, and it's a wholesale shake-up. But that said, the Saudis that you deal with here are well educated. They understand the sector very, very well. They understand the transformation and what they want to achieve at the end of it. And they really want to hear, well, they don't want to just move to what best practice is. They want to go one step further. They want to deliver the healthcare system of the future for Saudis very, very quickly. So it's a huge opportunity for companies coming in, especially those that are on the innovation end. There is investment available, there is support available, and there's a partner in the Saudi government that really wants to work with you. I'll probably stop there, but if there's questions, we can answer them later.
Thank you very much, Graham. That was very informative. I'll be passing on to our the microphone to our colleagues from the SFDA.
Thank you so much. Hello, everyone. We are so happy to be part of this webinar. My name is Wasim, and my colleagues are Ragad and Bashair. We are from Saudi Food and Drug Authority, and we are looking forward to talk about investor support in SFDA. Next. So for our agenda for today, we will talk about an overview for SFDA, YKSA, introduction about healthcare, medical device market in Saudi Arabia, and SFDA regulation for MD, pharmaceutical market in Saudi Arabia, and SFDA regulation for pharmaceutical, and how to contact with the SFDA. Next, please. So first of all, we will give you a brief introduction about SFDA. The main purpose of the authority is to oversee, regulate, and control food and drug and medical device, as well as to set standards for these products, whether they are imported or locally manufactured. Next, please. So to help achieve SFDA vision and mission, we have multiple international membership, such as we have SFDA represented the Kingdom of Saudi Arabia in AHWP, and also GHTF and NCAR. Next, please. And we also have our local strategic partners. As you can see, we have Ministry of Investment and also Customs and many other strategic partners. Next. So based on Kingdom of Saudi Arabia 2030 vision, SFDA has an effective role to encourage investment by developing a new department called Administration of Investment Development. And also we have electronic system for all the services that we provide in the SFDA, such as registration and clearing product. And also we have easy access to guidelines to explain all the requirements for the services. Also direct licensing for all warehouse and low risk activities. Next. So as we mentioned before about the easy access to the guideline, you can find all the guidelines and regulation and requirements on the SFDA website. Also, you can visit the user journey. Also, we have our own standard store, SFDA standard store, and also we have GCC standard store. So why you should invest in Saudi? Here's an overview about KSA. We have 34.2 million population, and as we all know, we are the heart of the Islamic world, and the GDP is 49.7% of industry. Next, please. Also, Kingdom of Saudi Arabia is the largest market and the largest economy in the Middle East and North Africa region. And it is accepted that if all the strategic goals of Vision 2030 are met, Kingdom of Saudi Arabia will become one of the 15 largest economies in the world. Also, KSA has one of the rapid logistic and distribution infrastructure in the region. We have wide network of sea, air, and road that make KSA ideal place to start your trading investment. Next. Also, Saudi Arabia provides a unique opportunity for investors by providing strategic locations, skilled labor, and access to land, raw materials, and technology. Next, we will talk about a brief introduction about healthcare. Saudi Arabia ranks 26th worldwide among 119 countries in terms of quality of healthcare. Also, healthcare and social development is a strong focus area by the government. Healthcare budget in KSA are accounting for over 68% of total government funding. Also, the increase of some of the disease has increased the government investment in healthcare. And now we will talk about medical device with my colleague Ragad.
Thank you, dear Wassam. Good afternoon, everyone. This is Ragad La'inazi from Saudi Food and Drug Authority. It is a pleasure to us to join and participate to this webinar. I will give you a brief overview about medical device market in KSA and our regulation in Saudi Food and Drug. Here in the first slide, we will talk about the total medical device market size in Saudi Arabia. Is actually estimated around $3.5 billion in 2019. And as you can see here in the following chart, the majority of market demand is created through imports. And our largest category value in Saudi market is consumables and disposable, actually account almost 39% of the total market. Next, please. Moving to the next point, the export opportunity to the accessible market. Actually, there's also potential opportunity to the accessible market beyond KSA. It will be estimated around $12.5 billion in 2019. Next, please. Taking into consideration the impact of different events, Saudi Arabia is expected to reach up to $7.2 billion in 2025. As you probably know, the recent event COVID-19, which has actually a positive impact in our medical device market in KSA. Next, please. Okay, what I was saying before about KSA and the ability to export to the accessible market, the total opportunity by 2025 is expected to reach around $26 billion. Okay, next. Okay, let's have a look to this page on the slide, which show the prioritization of opportunity in medical device. As you can see here in the first category, consumables and disposable, actually almost all subcategory has high potential in Saudi market. And if you see another example, the third one is diagnostic and imaging therapeutic radiation device. Some subcategories have high to average and low opportunity in KSA. Okay, next. Okay, here Saudi FDA must regulate any establishment trade any products under her umbrella, include medical device. Next. Okay, for the medical device, we have electronic system that name as GED or unified system. This system consists of several electronic services. The user can submit and follow the request and also pay required fees without visiting the branch of Saudi FDA. Okay, next. As I mentioned before, the electronic service in GED system is licensed services which allow the user or establishment to license her establishment in KSA. Product services to register their product, whether it is low or high risk. Okay, and the clearance services is to clear the shipment or the product when it reaches to the port. Okay, next. Actually, Saudi FDA has licensed facilities around 5,000 and registered around 300 products in our last update. Okay, that's all for the medical device. As my colleague Wassam mentioned before, all our regulation and standard, you can find it all in our website. Thank you all for your listening, and now with my colleague Bashair.
Thank you so much. Hello everyone, this is Bashair Sbai. I'm also representing Industrial and Investment Support Center at SFDA. I will talk about pharma markets and KSA, and then I will take you very briefly through SFDA regulations for investors in pharmaceutical products. Next slide, please. So as an overview of pharma markets in MENA region, KSA has the largest pharma market, and it's followed by Egypt and UAE. Higher disposable income and preference in foreign multinational brands have resulted in a dominant share of imported products. However, KSA is also demonstrating highest share growth of local production in the region also. Next slide. So in terms of value and volume, we can see in the charts here that original products dominate the market in value. And we actually have examples of originals that lead the market in value, like Humira and Novorapid. On the other hand, generics and other products represent the market in volume. Next. So these charts here showing the value and volume share in terms of formulations. As we can see, oral solids account the majority of the market, while parenterals and liquid and other formulations are still driving the market growth. Next slide. KSA market is also affected by therapeutic areas. This diagram shows top 15 therapeutic areas, whereas vaccines and antibacterials are the largest. And also we have some growing therapeutic areas like type 2 anti-diabetes and multiple sclerosis also. Of course, there is some slowdown in some therapeutic areas like antihypertensives. Next slide. Now, if we compare KSA imported products to the market, KSA market will show high value share, but we actually have some incentives from various government programs which have boosted the local production. For example, in antibacterials and allergy, we have companies like GSK and Spinaco that are manufacturing locally. And also Pfizer's local facility is driving major share of lipid regulators produced locally. Next slide. Also, in terms of exports by value, Saudi Arabia has ranked the 3rd largest exporter of pharmaceuticals in MENA region, and our largest importers include UAE and Egypt. Next. Now, regarding SFDA regulations for pharmaceuticals, next slide, please. We developed our first strategy in 2007, which has resulted in launching Saudi drug registration system in 2010. Second, the strategy was developed in 2012, and submission process continued to improve until the 3rd strategy came out, with total transformation to an electronic Saudi drug registration system in 2018, and we call it ESDR. Until now, we have around 700 licensed pharmaceutical facilities and more than 9,000 registered drug. For our local investors, we provide some benefits among our different regulations. For example, in product registration, local manufacturers will have priority in reviewing their files. Next slide. Also, investors, they will have price advantages. They will get fixed price for 5 years. And also in terms of plant certification, they have faster plant certification in addition to free consultation services regarding the plant design before the construction. And also they will get exemption from customs as a benefit. Now, this brings me to the end of my presentation. Thank you so much for listening. I know some of you might have some questions. We will try to answer as much as we can in the discussion session. And for any further inquiries, you can easily reach us through SFDA official contact channels. Next slide, please. Also, here is the email for Industrial and Investment Support Center. You can easily reach us through this email. Thank you so much.
Thank you, SFDA colleagues. That was very useful. I'll be handing the microphone now to Mohammed Azan from Informa.
Thank you, Yazan. Good morning and good afternoon, everyone. My name is Azan Mohammed, and I'm the Exhibition Director from Informa Markets, looking after the healthcare portfolio at Middle East and Africa. I would like first to thank Stuart, Graham, and the SFDA team for the very rich presentations. And on that note, I would just request to jump to slide number 7, to save the time and just to get straight to global health exhibitions, provided that a lot of the information around the Saudi market was already provided by the experts. I'll be more than happy to start the discussion around global health. So slide number 7, please. Okay, thank you. So Global Health Exhibition is an initiative that Informa started, more of like a revamped event that already exists in Saudi since 2013. And a bit of a background about Informa Markets, we are the largest organizer of healthcare events around the world. You might know us through Arab Health, the largest flagship healthcare events in the region, and so many other events around Africa, Americas, Europe, and Asia as well. Global Health exhibition specifically is a show that, as I mentioned earlier, was initially launched as Saudi Health back in 2013, working with a local partner and with the Ministry of Health support as well. We've decided after, I would say, around 2018 to revamp the show and acquire it 100% with the support of the Ministry of Health, alongside the support of other government entities in Saudi, such as NABCO, SFDA, CCHI, and the Saudi Council for Healthcare Specialties, as well as SAGI, previously the Ministry of Investment. Next slide, please. So in 2019, the last edition, which is the second edition, we've seen probably one of the fastest growing shows that we've launched in the past 10 years in the region. The show literally doubled the number of attendees over 1 year, and we've tripled the size of the exhibition to attract more international exhibitors with a very strong value proposition, which is what we've sort of discussed so far: enable international business to establish relationship, generate leads, and connect with decision makers and policymakers in Saudi. So the main objective of the show revolves around the pillars that we've been discussing so far around the Vision 2030 and the National Transformation Program. And the main vision is to position Saudi Arabian healthcare market to the international medical device manufacturers, service providers, dealers, and distributors. Global Health Exhibition was and still is the premier platform for the global healthcare industry to meet, learn, network, and do business. What we've tried to focus in and to give a very specific value proposition, because some of you might wonder, I could probably come to Arab Health and still meet Saudi attendees and visitors, and that's correct. Saudis are the number 2 visitors that comes into Arab Health in terms of our ranking of the top attendees. However, what we've done with Global Health is that we focus on the healthcare transformation, the healthcare investment and finance, technology and innovation, public health and e-health, among others, verticals in the Saudi market. And what we've noticed that around 40% of the visitors to Global Health Exhibition in Saudi never came to Arab Health before, which sort of like solidified our position to expand more into Saudi market and focus into a very specific visitor's persona, which is a Saudi buyer, distributor, or a decision maker and policy maker. So in 2019, we've attracted about 178 exhibitors from around 18 exhibiting countries and 5 country pavilions. We've also had about 15,000 attendees coming from 16 countries, obviously mainly led by Saudi visitors. What you'll find also quite interesting about Global Health is that in terms of our portfolio of healthcare shows, it has the highest conference attendees in the region, and that's because of the content that always been highly anticipated by the Saudi market, and it involved what I would say a balanced representation of leading local and international thought leaders and speakers. Next slide, please. More details and insights about the show. So in 2019, we sort of interested exhibitors as well. The show sort of generated around $26 million, and around 87% of the exhibitors came to Global Health or chose Global Health as a platform to find new business, and they've sort of given a satisfactory level of 85% were satisfied with the level of attendees to the show as well, and then somewhere around 83% with an overall satisfaction as well. In terms of the visitors, you will see exactly the reflection of what I mentioned earlier around the visitors data as well. A lot of these visitors, they come basically to Global Health for 2 main reasons. Distributors and dealers looking for international manufacturers to do business with. And also, you've got also healthcare procurement managers from different healthcare providers meeting and talking to main manufacturers of medical devices and different government entities represented in the show. But there's also a huge portion of healthcare professionals who come to the show to consume knowledge and to gain CME accreditation, which is essential to renew their license, their practice license every year. And they are also quite important for our exhibitors because these healthcare professionals have always been main influencers in terms of the procurement process. So all the educational tracks of global health are CME accredited, and it all involves local and international speakers, and also government entities, and most importantly, leaders, which is the main conference track, which is led by His Excellency Dr. Tawfiq, and it includes also a world-class international speakers as well. Next slide, please. So what I wanted actually to discuss here a lot more today is about what we've done so far during the pandemic. In Forma, we were one of the first to sort of look into what can we offer to our exhibitors during these difficult times, provided that there's no travel and face-to-face not an option anymore. What allowed us as well and helped us in this process is that we've already built a digital platform 2 years ago, that some of you perhaps heard about it, called Omnia Health. It started initially as a directory for exhibitors to list their services and products during the whole year, so you're not bounded by show days to meet visitors, where your products and your information are available 365 days across the year. And on top of that, we've sort of initiated new initiatives around virtual events. We ran our first event, which was more of our, I would say, global approach to the virtual since the pandemic in June. It took us literally about 1 month and a half to put it together, and it required a lot of work, but we were very happy with the results. The main objective for the virtual event basically revolves around as well the same value proposition of the physical event, allowing exhibitors to network, generate leads, and create brand awareness, as well as maintaining certain relationships and key contacts with government and policymakers officials. Next slide, please. So we've already decided on the dates. So 7th to 10th of December 2020 will be the virtual edition. His Excellency Dr. Tawfiq, the Minister of Health, has already confirmed, given his keynote address of the Leaders Conference. We will be making the announcement early next week, alongside a lot of information around how can you exhibit, what sort of sponsorship packages are there, and what are the main values, which I will just discuss really quickly. So business matchmaking, we're building a speed networking and a very targeted business matchmaking between the exhibitors and our database of attendees, decision makers, and healthcare professionals as well, based on what sort of interest and what sort of exhibitor profile we're dealing with. The educational sessions will also continue virtually through an agenda of webinars across the 4 days, clinical and non-clinical, and dividing leaders conference across the 4 days as well. So there's always a balanced representation of a high-level conference, clinical conferences, as well as sponsored webinars. Next slide, please. Going back again to the attendees overview, similar to the same physical event, it's the same data. In what also sort of more exciting for us is that right now we've got a better reach. If distance was sort of an issue for some visitors to come to the show physically, coming from Jeddah or Dammam, or being a healthcare professional who can't really leave the ship, now they can literally join over the phone or literally from the laptops. We've seen this in Omnia Health Live. Our conversion rate of attendees who registered to an event was around 80%, compared to the physical event, which only has about 40% of conversion of attendees who would pre-reg and turn up to the show. These are basically the personas of the different attendees that we have in our database, and we will be attracted to the show to meet you. Next slide, please. I'll be sharing the agenda with the DIT team and our associates at APHI made the link as well by early next week once we sign off certain details around the legalities of the virtual event as well, the contracts and everything. So hopefully by mid of next week, you will probably receive an announcement if you already know a database. If not, you will also receive from the DIT team. For any more information that you sort of would like to get about the show, you can tune into globalhealthsaudi.com, or you can reach out to me directly. I would like to keep the last few minutes for the organizers to allow for the questions. Thanks again for inviting me for this speaking opportunity. And last but not least, I would like to extend my thanks to all the healthcare professionals and the frontliners around the world during this tough time. Thank you. Back again to you, Yazan.
Thank you very much, Hassan. Finally, handing over to Hassan Chaudhary and our colleagues from DIT to give us to brief us about healthcare UK services and provide us with an intro to DIT in Saudi Arabia.
Thank you so much, Yazan, and it's an honor to be here with you all. My fellow panelists have done a great job so far. I'd like to explain broadly two things. One is what Healthcare UK does, and also digital health opportunities. So if you wouldn't mind going to that slide, thank you. I've got some bullet points here that I'd like to walk through. There's a long history of Healthcare UK supporting not just the NHS, but private sector to go abroad. Formerly, we were NHS Global. We are a joint initiative of a few different agencies, the Department for International Trade, the DIT, the Department of Health and Social Care, and NHS England. And we promote the UK's health and care sector overseas. We act as a bridge between the UK healthcare sector and international demand. And there are so many, well over 100 embassies and consulates where you've got commercial teams who are sourcing deals. They're finding and sharing that wealth of opportunities in all sorts of markets, and they're bringing them home to us based in London, in Whitehall. And we will then have our market teams look at those opportunities, whether they're in education and training, infrastructure, whether about managing hospitals, or, for example, in digital health. And that means that we can pass them to the right organizations who are ready for export, whether they're NHS or not. And we can even encourage collaboration between those providers, perhaps via consortia, to respond to overseas requirements. We also do the work inbound, so we provide a single gateway into the UK for foreign governments and industry. And the way that we work at Healthcare UK is that there's a group of civil servants who are focused on markets and regions. So there's a China team, there's an India team, there's a North America team, ASEAN and so on. And then you've got a team that specifically looks after the GCC, looks after the Gulf. And they're supported by sector specialists who come from the industry. I'm one of those. So I'm the digital health specialist, but you also have a medtech specialist at Healthcare UK. You've got an infrastructure specialist, education training, and we will provide support to the civil servants to make sure we understand the supply chain, the opportunities, and we can talk to the industry so that we can grab those high value opportunities. There are some key considerations that I think you need to consider when you go out to market, any market, and there's some that are more specific to your regions. And Healthcare UK can discuss that with you, along with our partners like AEI, and also our wonderful team in the region. So if you're on the webinar, you may already know about Ayman and Aya and Mena and others who will be able to support you on the ground. If we could move to the next slide, please. Now, I've come up with 10 universal questions in digital health to give an idea of how we can translate firms that have done work perhaps in the NHS in the UK and how they might transfer themselves into another market like Saudi. And the reason why that's important is because digital health is a very broad field and there can be a lot of confusion. And sometimes it's difficult for a buyer to put somebody in the right box to help them see. So these 10 questions are meant to help segment digital health and also to show just how impressive the development in Saudi digital health has been. Because there's a real desire, and I think it's been mentioned earlier on this discussion, that Saudi doesn't just want to get to where everyone else is. It wants to exceed. It wants to go beyond. It wants to get to the point in 10, 15, 20 years that we are all aiming to get to in 10, 15, and 20 years, wherever we are in the world, in the developing countries. And Saudi is making fantastic progress. So let me just go through these 10 questions very briefly. The emphasis in a lot of countries now is not to react to patients who are sick and they're coming in, but to empower citizens, to enable them to care for themselves. Self-care is the big deal. And that's why you've got lots of apps now where patients are able to use their mobile phones. They can have AI on those phones, have a chatbot, maybe even have a remote consultation. The second is about how do we triage, stream, and redirect patients so they go to the right place and they don't overwhelm us. The third is got to think long-term, screening and diagnostics. Fourth is when someone has actually now got a physician, got into the healthcare system, how do we look after them remotely, perhaps with digital therapeutics, wearables, remote monitoring. Number 5 is about data. And there's so much going on with data in the UK, which you'll see parallels now with Saudi as they make the most of their health data. Number 6, how do you augment healthcare teams so they can do more? 7, how do you make systems more efficient? 8, communication. 9, the great challenges that we have in, for example, in the UK, we talk about healthy aging. There are massive challenges happening. For example, in Saudi, non-communicable diseases is a very big deal. And number 10, future tech, how do you take advantage? Now, if you can put yourself in one of these buckets, it helps to translate your offer and your position to other markets. So we can say to people in Saudi, this is a company that fits very well in perhaps bucket 6 and bucket 8, and that will help translate. So it's worth understanding that these are the ways that we look at companies and put them together and then explain them to buyers. And that's what we really want to do. I'll make a final comment. If you were to Google Lancet and the Riyadh Declaration, you'll see that there's been a recent declaration on digital health that was formulated during the Riyadh Global Digital Health Summit, which was in August. And the forum really highlighted the importance of digital technology, data, and innovation. And it shows that Saudi Arabia is really taking this seriously. They want to implement data-driven and evidence-based protocols for clear and effective communication to build citizen trust, as an example. They want to implement a standard global minimum data set for public health data reporting. They really are going to make the most of it. And I think that if you're a company looking to export, the Saudi Arabian market is one that you really should be taking seriously, and Healthcare UK can support you. So with that, I'd like to hand back to Yazan. Thank you.
Thank you, Hassan. Handing over to our colleagues from DIT. I am Atuk and I'm Onabegi.
Thanks, Yazan, and thanks for all the speakers. That was very informative webinar from all aspects. So I'm just going to take a couple of minutes. I'm not going to make it a bit long. Just a quick introduction to who we are at DIT. So we are the people who are based at home. I'm Alamatu. I lead the healthcare sector at the Forum for International Trade. And we are a team of 3 people, myself, Ayman Abdi, and Minna Salama. We cover opportunities in Saudi Arabia, and we're based in 2 provinces, Riyadh and Jeddah. Our main focus is to support UK companies to engage with the Saudi market in alignment definitely with the Vision 2030. So what we do, we support companies in different ways, from introduction to main stakeholders and post to market research analysis. We provide support in all aspects, whether directly from us, from our team, or through our commercial partners. We make sure that companies who have interest in the Saudi market get access to what is needed, even with exhibition and all sorts of marketing activities and trade mission. So at DIT, we enable and support firms to seize the opportunities of trade and international investment to establish a culture of export in the UK. We also ensure the UK is recognized as the best place to invest, to attract and retain and grow international investment, which strengthens the economy. We open market, build a trade framework with a new and existing partners, which is free and fair. That being said, our contact details will be shared after the webinar for any questions or inquiries from any companies who attended today or registered through the webinar. I'll hand over now to my colleague Ayman Baiti to introduce himself as well, and then we will move to the question and answer part, which is going to be led by Yazan as well. Handing over to you, Ayman.
Yes, thanks, Aya, very much for that. I just wanted to introduce myself. My name is Ayman Abidi, and I lead the life sciences sector in Saudi, and I'm based at the consulate in Jeddah. And I just wanted to echo something that Stuart said at the beginning of the webinar, which is that Saudi may be a tough market to do business with its share of obstacles, but we are here to help UK companies overcome these obstacles, as well as help educate UK companies on how this market is transforming into one of the most important markets in the world. And please, I encourage everyone who wants to reach out to me or I or anyone in the team, please do so, and we are happy to hear your feedback and your comments. Back to you, Yazan. Thank you.
Thank you, Ayman. Now we move on to the Q&A session at the end of our webinar. We have received a number of questions regarding visas, which we would be happy to take offline, and also regarding slides, which we will also share after this webinar with all of you. I have a question here, which I will address to Aya. The question is from Yara, and the question is there a platform or a database where the RFPs/RFQs are published, and how we can apply from the UK?
Hi, Yara, thanks for asking. So yes, there's a couple of platforms for RFP, RFQs. We can definitely walk you through the process itself. I will email you separately with a couple of these options. So we have the most kind of popular one for the Attendees, but I will email you with a couple of links and walk you through the way to take it forward. But I will take it separately with you. Thank you for asking. Back to you, Yazan.
Thank you, Aya. Right, so we have another question here, which I will address to SFDA. So we're receiving a large number of questions, so we'll try and address as much as we can, just cautious of time here. Sorry, do software solutions, not medical devices, need registration or certification in KSA? I think I'll address this question to SFDA.
Can you repeat that, please?
Do software solutions, I'm assuming digital software solutions, need registration or certification in KSA? So healthcare solutions, I'm assuming.
Yes. Actually, I think yes, but I don't know what is the actual classification for this software. It is like a medical software or what?
I think they're referring, yes, to a medical software.
Yes, we have. They should to register in SFDA.
Okay. Thank you. And the next question, I think I'll address the next question to Graham.
All right.
Sorry, Graham, just many questions, and I'm trying to point to the question here. Right. Strategically, is there any focus on the wide-scale collection and use of federated biomedical data for scientific research and AI-centric big data analytics? If so, which ministry is driving such initiatives?
I think, to be honest, so again, it's slightly out of my area. My view on it, though, would be probably not at the moment. It is something, though, that is within a lot of the planned work. So they're doing a number of initiatives, or they're putting in place a number of initiatives to collect significant amounts of this type of data. And they do have a particular arm of the governance work stream of the Ministry of Health that is looking at the research aspects of healthcare, and that covers not only funding for research, but also the rules around some of the access for data. In addition, there's a new entity being created for health information management, NHI, and that's responsible for all of the governance arrangements around health data. So if I was to just summarize, the answer is probably no, but they are heading in that direction. So there is an opportunity to start a discussion with them and the different entities if there's a particular solution and there's a value associated with that. I hope that answers the question.
Thanks very much, Graham. We have another question here for SFDA. How can a UK manufacturer for medical nutritional products register their products with SFDA? This question is from Ryan.
Yes. Is it medical nutritional? You mean it's a health supplement?
I assume so, yes.
Yeah, so for health supplements and for any institution that wants to sell some such pharmaceutical products, if it's in dosage form, pharmaceutical dosage form like capsules or tablets, so it will be considered as a health supplement, and the establishment should have license from the Ministry of Investment. Then the establishment itself also should have a license from SFDA. Then they will start the process of registration their products regarding based on the guideline. We have guidelines for the health supplement submission. So this is in general.
Okay, thank you very much. Question for Hassan. Are there existing centers for excellence who want to work with healthcare companies to develop systems to keep patients at home or via telemedicine? This question is from Liz Lindsay.
Thank you, Yazan. Actually, what's happening in Saudi Arabia is it's not just down to one center of excellence. I'm starting to see centers of excellence all over the country where their clusters are forming. And if you were to go in with an approach with Aya and Ayman and others, they will be able to point you to the right kind of local partners and buyers who've got a real attention to detail on those areas. So there's no single area, whereas if, for example, in the UK, you might say NHS Digital is your partner, or perhaps NHSX. Here, the clusters are where I would focus. And I think what's really important is that you're seeing Saudi really taking it seriously, where homegrown talent is taking on digital health initiative rather than just bringing in management consultancies from the outside. So you're starting to see it spread throughout the country.
Thank you, Hassan. Question here for Azan regarding the Global Health Exhibition. Is Healthcare UK/ABHI having a pavilion at the Saudi Global Health Exhibition in December?
Well, yes, initially the plan was to, we've had a pavilion scheduled for GHE 2020, the physical one before the pandemic. But actually, literally, we've got a call perhaps later this afternoon with the ABHI team to discuss the virtual representation of that pavilion. So yes, there is a plan for it, and we will be making the announcement accordingly through the ABHI team by next week.
Thank you, Azan. One more question for SFDA. Is there any fast track registration for imported pharmaceutical products?
Can you repeat the question?
Is there any fast track registration for imported pharmaceutical products?
No, actually the fast track registration for localization products also only. As I mentioned in my presentation, the local investors, they will have priority in reviewing their files, and they also can submit their products in parallel with the licensing their institution in Saudi Arabia. So they can submit the product before the they get the license. And it's also only for the local products, local manufactured products.
Understood. Thank you. One more question, I think, which I'll address to Aya. Digital health is of prime importance in the current climate, and Vision 2030 seems to have a large focus on digital transformation and digital health solutions. As a manufacturer of diagnostic and patient monitoring devices aimed at telehealth solutions, who can we contact to discuss how we can support the Saudi government in these objectives?
Hi, Gavin. Thank you for asking. So it will be addressed to us at the DIT, me specifically, and my colleague Ayman. We work very closely with the digital department at the Ministry of Health, who are working on the e-health strategy, and we already work with their different departments who looks after, in specific, the telehealth solution. So I can share with you some strategies and opportunities after you maybe share with us a company profile or what are the services that you can provide. So once our contact details are shared after the webinar, please send me all the details and we can start discussing these opportunities. Before I hand over back to Yazan, I know there's a couple of questions from Mahid Haidari for a local presence question, which and another platform. So of course you need to register to have a local partner here in Saudi or to be 100% investors. So yes, you have a couple of options in order to operate and work in Saudi, which we can kindly share between us and AEI and provide the support needed, whether it was to register with SAGIA, the Saudi Investment Authority, the Ministry of Investment, to have 100% license as an investor, or to work with a local partner, which we can of course connect you with kind of some options for local partners in Saudi. So I think I will hand over back to Yazan, but we can we have received a lot of questions, but we're just thinking about time of those speakers. I will hand over back to Yazan. I'm sure we can deal with the rest of the questions separately.
Thank you, Aya. So we've come to the end of this webinar. Thank you all for your questions. For those who have any other questions, we will share our emails, our contact details with all of you following this webinar. So please feel free to send your questions and we'll address them afterwards. Finally, I'd like to thank all of our speakers for taking the time out of their busy days to support this webinar. And thank you all for dialing in. This webinar has been recorded and will be also shared with you all. Have a great day. Thank you.